Are you about to finish nursing school and freaking out because you don't know where to even begin for studying for your NCLEX? Well, don't worry, I got you. I have developed a foolproof formula for passing the NCLEX in 75 questions on your very first attempt. By the end of this video, you will have all of the tools that you need to pass the NCLEX in 75 questions. Hi, my name is Tiana. I'm a critical care nurse. I passed the NCLEX in 75 questions using this proven method that I've developed, and I want to share it with you because, guys, I want you to be successful. If you are ready to pass the NCLEX in 75 questions on your very first try, I want you to type PASS in the comments section down below. PASS, P-A-S-S. We're going to put it out there. We are going to manifest your destiny. So put it out there so that the universe knows you're going to pass the NCLEX. Grab yourself something to take notes with, grab some water, get comfortable, and let's go. So step 1 to my foolproof formula on passing the NCLEX your first time is see it. You need to review it. Review. It is so important that you know all the body systems from neuro to endocrine to pulmonary, every type of nursing from mother-baby to psych nursing to community nursing. It's crucial, and I know it's a lot of information. It can seem very daunting, but there are tools out there to help you, such as Hurst Review, which is what I used. I strongly believe in it. It actually helped me so much that when I was taking my NCLEX, I heard the voices of the NCLEX people just guiding me through it. So it's a little pricey, but it's completely worth it. And I'm going to do a full review on it and the other things that I use for the NCLEX with a giveaway. So keep your eyes peeled for it. Review it all. It doesn't matter how you do it. You can use an NCLEX prep book. You can use NCLEX websites for prep like nursing.com. There are a ton of different websites that you can pay subscriptions to and gain access to their nursing questions and their review information. If your school is like mine and you use ATI, then you have access to that and you can review the different chapters and sections and body systems using that. It doesn't matter how you do it. You know your learning style, your study style best. So however you need to review that information, do it. And you may feel tempted to just review things that you are pretty bad at and then just think, you know, I'm a god at cardio. I don't need to worry about that. And so then you focus on everything else. And then you think, okay, well, I was really good at cardio 4 weeks ago. Well, now it's 4 weeks later and you've been studying all this other information and your knowledge from cardio is 4 weeks old and you have all this new information. Well, that old information isn't going to be so fresh anymore and you're no longer going to be an A+ star in cardio. So make sure you review everything from your weaknesses to your strengths during part 1 of this formula. You got that? Part 1 is see it. I don't care how you get your eyes on the information, just review, and don't leave anything out, no matter how good you are. Make sure you know it and the rationale behind the it. Step 2 is say it. You have to talk about it. Talk it out. Get it out there. You use a different part of your brain when you're reading something than you do when you're speaking it. And if you can think it and speak it, then you're going to pass the NCLEX. So make sure you don't skip this step. Different examples on ways that you can say it is get together with your close friends, get together with your study group and talk it out. Go through all the different systems. If one of you have an NCLEX study guide book format type thing, then go to the back of the sections, go to the back of the chapters and talk about all the questions together. Just talk it out. You can use your textbook from different classes. The great thing about getting together with your peers and talking these things out is that you get to hear different points of view, different ways that they comprehend that material, and that'll strengthen your comprehension. Also, if they're a little rusty on some things and you are amazing at it, then teaching that, sharing how you kind of comprehend that information, that strengthens your knowledge of the material and solidifies it in your mind even more. So you both benefit. It's a beautiful thing. Another way that you can say it is something that I did. If you've seen my past videos, then you know my study buddy, Mr. Bones. I don't know if you know, he used to hang right up here behind me. So I used to sit on my desk back and look back at him and teach him everything that I needed to know. And so if you have a Mr. Bones, or if you want to teach your kids or your dog, it doesn't matter. Just make sure that you're saying it, because that'll solidify the information in your brain so that you can pass the NCLEX. Part 3 of this foolproof formula is do it. You have to put all of your knowledge into practice. You're probably thinking, Tiana, I'm not a nurse yet.
I can't practice.
Well, duh. What I mean is, do the practice questions over and over and over. The NCLEX is a marathon. It is not a sprint. So you need to prepare yourself in the days to come. I took 2 full weeks to study prior to my NCLEX. It was 2 full weeks that I studied, and then I took 1 solid day off. So I did nothing but relax and enjoyed myself the day before my NCLEX, so I wasn't stressed. So whether it takes you 2 weeks or 4 weeks, make sure you give yourself enough time to review all of that information. And you're probably like, Tiana, how in the world did you determine 2 weeks was enough? Well, if you watch my study tips video, I'll post it somewhere up here, then you'll see how I determine how much time I need to study for certain things, and it'll help you kind of figure out how much time you may need to study. Let's get back to step 3, doing it. So different ways that you can put this information into practice, I did say, is reviewing the study questions. I've said it over and over, doing the questions in your book, but I think the best thing to do to practice for the NCLEX is doing questions online, because your NCLEX is it's computerized. It's a computerized test. So getting used to that kind of format is going to be so beneficial for you. Using sites like uWorld is very beneficial. There's other sites like Quizlet, I'm sure you can use. Hurst Review, Kaplan Review, I believe that they offer test questions. I know nursing.com offers test questions. Another fun thing that I did when I was preparing for the NCLEX was I used a board game. I can't remember what it was called, but it was an NCLEX nursing board game, and I hosted study sessions with the other girls in my nursing class. And we'd get together, we'd play the board game, and we'd discuss it. So we were saying it and doing it at the same time, and all of us passed the NCLEX on our very first try. So I'm telling you, this method is proven. You just have to do all 3 parts of the formula. You can find free quizzes online, and if your school does have ATI, you can do the ATI questions over and over. Now, I do have a rule for part 3, and that is the 70% rule. The 70% rule means that you don't have to do all 200. I think there are 265 questions available on the NCLEX. I may be wrong, but it is over 200. So am I telling you every day leading up to the NCLEX you need to practice 280 some odd questions? No, do 70% of that. Definitely don't do any less than that, because I don't want you to get test fatigue. Sometimes the NCLEX randomly picks people who have to take the whole entire set of questions. Not because they're doing bad or they're doing incredibly well, it just randomly picks someone. Be prepared to be that person. I don't want you to get test fatigue. So, like I said, it's a marathon. You need to really prepare yourself in the days coming. So do 70% of 280 something, which I don't know is probably 180 to 185. Make sure that you are doing 185 questions for at least 2 weeks before you take your NCLEX. And again, 70% rule, you don't have to get all of those correct. You only have to get 70% of those correct. So when I was practicing for the NCLEX, not only was I doing 180 some odd questions every other day, but I was also doing uWorld. I was probably doing 10 10 uWorld questions in the morning, 10 uWorld questions in the afternoon, then maybe 10 uWorld questions in the evening. And I wasn't getting 100% of those right. I was getting 70% of that right. And I was happy with that because at 70%, you have a very good likelihood of passing the NCLEX in 75 questions on your first attempt. So guys, you must use all 3 parts of my formula in order to be successful on the NCLEX. You need to see it, review. It doesn't matter how you do it, but review all of the systems, all of the different kind of nursing. 2 is say it. Say it, talk it out, discuss it with your peers, discuss it with anybody, teach it, tutor it, talk it out. It doesn't matter how you do it, but you need to use that other part of your brain so that you can ensure that you are really comprehending that information. Number 3, do it. You need to really practice putting that knowledge into place. Utilize it. Bonus material! Guys, let's talk about test taking strategies. Okay, so when you're taking the NCLEX, always have in mind airway, breathing, circulation. ABCs, airway, breathing, circulation. Airway is always first. Always make sure that your patient's airway is secure. You always want to think to yourself when you're taking the NCLEX, could my patient die? Right? So if your patient doesn't have a clear airway, of course they're going to die. If your patient is bleeding, they may bleed out. Of course they're going to die. The NCLEX wants to make sure you're a safe nurse. So prevent your patient from dying and stop anything that indicates death. Basically, when you're taking your test and you're reading the question options, if something seems a little bit like, I don't know, then it's wrong. Like, leave the patient to go get help. That answer will always be wrong. You never, ever leave your patient. Did you hear me? Never leave your patient. It doesn't matter what's going on. Your patient could be having a seizure and you could be the only one in the room. You don't leave your patient. You push the call light. You scream for help. You do anything, but you never leave your patient. Something else that you never, ever do, if you see it on NCLEX, don't choose it. It's wrong. Ask why questions. WHY. Why do you want to hurt yourself, patient? Why didn't you take your pills, patient? You never ask that. You never ask why questions. Also, when you are trying to prioritize which patient to see first, you always pick the sickest patient, the patient who is closest to death. So let's say that you have a patient who has a low blood pressure and you also have a patient who is freshly post-op and they have a fever. Well, which patient are you going to see first? The patient with the low blood pressure or the patient with the fever? Who's more likely to die? Is a fever going to kill you? A fever alone won't kill you. But low blood pressure means reduced perfusion to your brain, which means, you're closer to death. So see your hypotensive patient before you see your hyperthermic patient. Always think, who is more likely to die if I don't go see them right now? That's how you answer your NCLEX questions. And always assume that your patient is going to die. Assume the worst, always. It's the NCLEX. There's no happy patient in the NCLEX. They don't ever just go home happy and well. They're trying to make sure that you're safe, that you can identify dangerous circumstances, dangerous situations, and that you can prevent patient death. So be safe. Stay with your patient, protect their airway, keep them from dying. You got it? Subscribe to my channel so that we can do this again soon. Please follow up. Tell me how you're doing after you take the NCLEX. I want to know all about it. I love you guys. Till next time. You are a safe nurse. I believe in you. You got this.